Cardiac emergencies. Introduction. Cardiac emergencies are life-threatening conditions affecting the heart that require immediate medical intervention to prevent severe complications, disability, or death. These emergencies may arise from structural, electrical, or vascular dysfunctions, leading to circulatory collapse, organ damage, and multi-system failure. Prompt recognition, timely treatment, and advanced medical care are essential in managing cardiac emergencies effectively. Definition. Cardiac emergency: any acute, life-threatening cardiac condition that requires immediate medical attention to restore normal cardiac function and prevent death. Types of cardiac emergencies. Acute coronary syndrome, ACS, includes myocardial infarction, heart attack, and unstable angina caused by reduced blood supply to the heart muscle. Cardiac arrest, sudden cessation of cardiac activity, leading to the absence of pulse and loss of consciousness. Heart failure exacerbation, sudden worsening of heart failure symptoms due to fluid overload and decreased cardiac function. Cardiogenic shock, a severe drop in blood pressure due to inadequate pumping of the heart. Hypertensive emergency, critically high blood pressure leading to organ damage. Pulmonary embolism, PE, blockage of pulmonary arteries by a blood clot, leading to right heart strain. Aortic dissection, tearing of the inner layer of the aorta, leading to internal bleeding and circulatory collapse. Pericardial tamponade, accumulation of fluid in the pericardial sac compressing the heart and restricting its function. Arrhythmias, abnormal heart rhythms, includes ventricular fibrillation, ventricular tachycardia, atrial fibrillation, and complete heart block. Causes and risk factors. Causes: coronary artery disease, CAD. Hypertension, high blood pressure. Valvular heart diseases. Myocardial infarction, heart attack. Arrhythmias, irregular heartbeats. Pulmonary embolism. Aortic aneurysm or dissection. Cardiac trauma. Risk factors: smoking and excessive alcohol consumption. Obesity and sedentary lifestyle. Diabetes and high cholesterol. Family history of heart disease. Stress and drug abuse, example cocaine. Poorly controlled hypertension. Pathophysiology of cardiac emergencies. Triggering event, example ischemia, hypertension, arrhythmia, trauma. Down arrow. Myocardial dysfunction, impaired oxygenation, electrical instability, or mechanical obstruction. Down arrow. Reduced cardiac output, decreased blood flow to vital organs. Down arrow. Tissue hypoxia and metabolic acidosis. Down arrow. Organ failure and circulatory collapse. Down arrow. Death if untreated. Clinical manifestations. General symptoms of cardiac emergencies. Severe chest pain or pressure, radiating to the arm, jaw, or back. Shortness of breath. Palpitations or irregular heartbeat. Dizziness or fainting. Profuse sweating. Cold, clammy skin. Cyanosis, bluish discoloration. Severe hypotension or hypertension. Signs of shock, confusion, decreased urine output. Specific symptoms based on condition. Acute coronary syndrome, crushing chest pain, nausea, vomiting, sweating. Cardiac arrest, sudden collapse, unresponsiveness, no pulse. Heart failure exacerbation, severe breathlessness, swollen legs, fluid accumulation in the lungs. Pulmonary embolism, sudden breathlessness, chest pain, coughing up blood. Aortic dissection, tearing chest pain radiating to the back. Arrhythmias, irregular heartbeats, palpitations, syncope, fainting. Cardiogenic shock, extreme hypotension, weak pulse, altered mental state. Diagnostic evaluation. 1. History taking. Onset, duration, and nature of symptoms. Presence of chest pain, breathlessness, or fainting. Past medical history, hypertension, diabetes, CAD. Use of medications and any recent cardiac symptoms. 2. Physical examination. Blood pressure measurement, hypotension or hypertension. Pulse rate and rhythm, tachycardia, bradycardia, irregular pulses. Heart sounds, murmurs, abnormal heart rhythms. Signs of heart failure, jugular vein distension, edema, crackles in lungs. 3. Specific diagnostic tests. Electrocardiogram, ECG detects arrhythmias, myocardial infarction, conduction abnormalities. Cardiac biomarkers, troponin, CKMB confirms myocardial infarction. Echocardiography, evaluates heart function, valve disease, pericardial effusion. Chest X-ray, identifies pulmonary edema, cardiomegaly, aortic dissection. CT angiography, detects aortic dissection, pulmonary embolism. Arterial blood gas, ABG assesses oxygen levels and acid-base balance. D-dimer test, helps in diagnosing pulmonary embolism. Medical management. 1. General emergency treatment. Airway, breathing, circulation, ABC, assessment. Oxygen therapy, given in hypoxic patients. 4. Fluid resuscitation, to maintain blood pressure and circulation. Continuous ECG monitoring, to detect and treat arrhythmias. 2. Condition-specific treatment. Acute coronary syndrome, aspirin, nitroglycerin, thrombolytics, percutaneous coronary intervention, PCI. Cardiac arrest, immediate CPR, defibrillation, if shockable rhythm, epinephrine, amiodarone. Pulmonary embolism, anticoagulants, heparin, warfarin, thrombolysis in severe cases. Hypertensive crisis, 4 antihypertensives, nitroprusside, labetalol. Aortic dissection, beta blockers, pain control, and emergency surgery. Pericardial tamponade, emergency pericardiocentesis, removal of fluid around the heart. Arrhythmias, antiarrhythmic drugs, pacemaker insertion for bradyarrhythmias. Surgical management. Coronary artery bypass grafting, CABG for severe coronary artery blockages. Percutaneous coronary intervention, PCI angioplasty and stenting for ACS. Pacemaker insertion, for life-threatening bradyarrhythmias. Implantable cardioverter defibrillator, ICD for prevention of sudden cardiac arrest in high-risk patients. Valve replacement surgery, for severe valvular heart diseases. Pulmonary embolectomy, for life-threatening pulmonary embolism. Nursing management. 1. Ineffective tissue perfusion, cardiac, related to decreased cardiac output. Interventions. Monitor vital signs, especially blood pressure, heart rate, and oxygen saturation. Assess ECG for changes in rhythm, ST segment abnormalities, and conduction disturbances. Administer oxygen therapy as prescribed to improve myocardial oxygenation. Administer prescribed medications such as vasopressors, antiarrhythmics, or anticoagulants. Position the patient in a semi-Fowler's position to reduce cardiac workload. Monitor urine output as an indicator of organ perfusion. Prepare the patient for emergency interventions, example PCI, thrombolysis, or surgery, if required. 2. Acute pain related to myocardial ischemia or tissue hypoxia. Interventions. Assess and document the characteristics of pain, location, duration, intensity, and radiation. Administer prescribed analgesics such as nitroglycerin or morphine. Encourage deep breathing and relaxation techniques to reduce anxiety. Maintain a calm and reassuring environment to decrease stress and myocardial oxygen demand. Continuously monitor ECG for worsening ischemia or arrhythmias. Educate the patient about recognizing early warning signs of cardiac pain. 3. Decreased cardiac output related to arrhythmias or myocardial dysfunction. Interventions. Monitor for signs of decreased cardiac output, hypotension, weak pulse, confusion, cool extremities. Assess for and manage arrhythmias using telemetry or continuous ECG monitoring. Administer medications such as beta blockers, calcium channel blockers, or antiarrhythmics as prescribed. Initiate CPR and advanced life support if cardiac arrest occurs. Prepare for cardioversion, defibrillation, or pacemaker insertion if necessary. Educate the patient on lifestyle modifications to improve cardiac function. 4. Risk for fluid volume overload related to heart failure or cardiogenic shock. Interventions. Monitor intake and output, daily weight, and signs of fluid overload, edema, pulmonary congestion. Administer diuretics as prescribed to reduce fluid retention. Restrict sodium and fluid intake based on medical orders. Position the patient in a high Fowler's position to improve breathing in cases of pulmonary edema. Monitor electrolyte levels, potassium, sodium, and renal function. 5. Anxiety related to fear of death, uncertainty about prognosis, or lack of knowledge. Interventions. Provide clear and concise information about the condition and treatment plan. Use therapeutic communication to encourage the patient to express feelings and concerns. Offer reassurance and emotional support to reduce stress. Allow family members to be present, if appropriate, for additional comfort. Provide relaxation techniques such as guided imagery or deep breathing exercises. 6. Risk for ineffective breathing pattern related to pulmonary congestion or respiratory distress. Interventions. Monitor respiratory rate, depth, and breath sounds for signs of distress. Administer oxygen therapy or mechanical ventilation if indicated. Elevate the head of the bed to ease breathing. Administer prescribed bronchodilators and diuretics to reduce fluid in the lungs. Encourage controlled breathing exercises to improve oxygenation. 7. Risk for sudden cardiac arrest related to unstable arrhythmias or myocardial infarction. Interventions. Keep emergency resuscitation equipment, defibrillator, emergency drugs, readily available. Monitor ECG continuously for life-threatening arrhythmias. Initiate CPR and advanced cardiac life support, ACLS, protocols if cardiac arrest occurs. Educate at-risk patients and families on recognizing warning signs and when to seek emergency care. Encourage follow-up care and medication adherence to prevent recurrence. Complications. Sudden cardiac death. Multi-organ failure. Stroke due to embolism. Heart failure. Renal failure due to poor perfusion. Recurrent myocardial infarction. Prevention. Control hypertension, diabetes, and cholesterol levels. Quit smoking and avoid excessive alcohol intake. Maintain a heart-healthy diet and exercise regularly. Manage stress and avoid drug abuse. Regular cardiac screening for high-risk individuals. Learn and practice CPR for emergency response. Conclusion. Cardiac emergencies require rapid recognition and immediate intervention to prevent fatal outcomes. Early diagnosis, proper medical management, and preventive strategies are essential in reducing morbidity and mortality associated with these life-threatening conditions.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.